what you think is good may not be good and cannot be understood by the community. So let's say for our materials, we actually pilot them and try them out before we go on a national scale. I'm very fortunate at this point that I have a health communications team right in my office. I actually have one person who takes care of answering Twitter, answering email, and coming up with new ideas. But since our program now is a national program, we cannot issue anything in public until it's cleared by the Department of Health. So I guess, you know, I've given the suggestion yesterday in our group that if DOST, specifically PCHRD, can probably come up with a seminar just to give our community of researchers to talk about popularizing ideas, but not necessarily imposing on them that they have to do it. I feel, you know, like if I will expect each of my researchers to crack their heads to come up with the popular ideas, they will not be the best persons to do that. So in our case, I have a team that deals with the popularization of that one. But as a researcher, I must have the ideas to make it happen.
So you have your health communication team.
Yes, it really helps.
Okay, I move on to Dr. Mercado. Sinabi niya earlier about the importance of communication. So how do you ensure that research results and innovations reach public knowledge and the communities in need, especially now in digital convergence?
I think the basis of good communication is listening. And leaders cannot lead unless they know how to listen. One half of communication is about understanding what your audience is ready to hear, or where they are, where their minds are. And so in order to communicate, you have to understand your audience. And you won't understand your audience unless you're accessible and unless you care about them. So earlier I said my big hugot was the enemy is indifference. And in research, it's the same thing. If we think we can come up with answers and that people just deserve to get our good ideas and use them without our willingness to listen to what they are really concerned about, we will not be able to link the outcomes of our research to the problems that they face. So I would say that researchers need to learn how to listen and understand their audiences. And that can only happen if they truly care and are not indifferent to the needs of people.
I asked the mayor, what do you think is the best mode of popularizing or communicating your researches, health innovations, or programs in your community?
For governance in my experience, again, there's three ways that we look at how we communicate the program. One is first to define your area of governance. In this age, kasama na yung, dati, yung govern, you only govern in your place. Ngayon, with social media, kasama na yung lahat na nangingialam sa'yo through social media. So you have to govern them as well. So that's one aspect of communicating is to them. Then second is, what are you trying to achieve with your communication? Is it health-seeking behavior? Is it pushing the program towards your communities? So by understanding yung goal mo, sa amin, it's health-seeking behavior. So we push to their families, we push through social media, so that yung mga OFW can influence back their families to make sure that they adhere to the programs. And lastly, it's you're communicating trust. Kasi as a local leader, dapat maniwala muna sila sa program mo.
Kayo muna.
Oo, maniwala sila sa'yo as a leader. Kasi kung hindi yan naniniwala sa leader, kahit anong innovation.
Kasi we depend on the source of the technology for that. Siguro ito yung second hugot is, sana after so many years, more than 22 years of commercializing Lagundi and Sampo, royalties have been paid, license fees have been paid every 3-5 years. sana magkaroon din ng additional na studies. Kasi syempre, when the clinical trials were done before, there were still no good clinical trial practice guidelines and so on. And even the way the product is standardized is based on the dry weight of the leaves, for example. Wherein, I think it would be very easy now for the scientists, especially those in this room, to be able to standardize, let's say, the quantity of the active ingredient, be it lagundi or another plant. So there's there's a lot that would have been done in the past 20 years, but I'm hoping that in the next maybe 5 years, because of what we're doing here, more scientists will be interested to build on, let's say, the science of those technologies that have already commercialized, so that it becomes also more competitive against the imported synthetic drugs. The output of you guys that conduct the research